Good evening, everyone. This is Lloyd Smucker, Congressman for Pennsylvania's 11th District. That district covers the southern part of York County and all of Lancaster County as well. I'd like to thank you for joining me this evening for Telephone Town Hall. We're going to discuss what's going on in both D.C. and right here in our community. I will take as many questions and comments throughout the next 60 minutes as I possibly can. And you'll have an opportunity to do that, and you can get in the queue for that right now. The way you do it is if you'd like to ask a question or a comment at any time, you press *3 on your telephone. Again, it's *3 on your telephone to get in the queue. My staff is available. We'll be answering your call, and we'll get to as many questions as we can. So you can do that right now, *3 on your telephone. Those of you who've been on these calls before, I repeat myself a little bit in the beginning because as we're talking, people are continuing to join us. So again, good evening, everyone. I'd like to thank you for joining me. I'm Congressman Lloyd Smucker, representing the 11th District, and I'd like to welcome you to our telephone town hall. Press *3 on your telephone right now if you'd like to get in a queue with a comment or a question. I want to just start by thanking you for the opportunity to represent you in D.C. This is an absolutely outstanding district to represent, and it's a real privilege and an honor for me to be your voice in Washington, D.C. I look forward to any interactions I have with the people across the district, but we found this to be an effective tool that a lot of people join us on these calls, and then I have generally received a lot of great feedback from people who participate in it. So we probably up to about 35 to 40 of these I've done since I've been in office, and look forward to our discussion this evening. So again, people are still joining us, so apologize for repeating, but this is Lloyd Smucker, Congressman from the 11th District. Thanks for joining us for the telephone town hall. To get in the queue, press *3 on your telephone. You can do that right now. I do want to start with just a brief status update of where we are in our fight against COVID-19, the coronavirus. And I'd be happy to take additional questions on this if you have some. But, in Pennsylvania and here locally as well in Lancaster and York counties, despite variations that we're seeing in new confirmed cases, the most important data figure to be watching is our hospital capacity. That's the number of people who are in the hospital, the number of people who are in intensive care in the hospital. And remember, the point of shutting down the economy, the point of social distancing and all was to ensure that, as the virus spreads among us, we slow that spread to ensure that our local hospital systems aren't overwhelmed. And I want to remind you again about what some of the initial modeling showed for our area. We received early on, beginning of April, input from all of the hospital systems in Lancaster and York County, and we all shared concern that the projections that were being shown show that we would need a lot more hospital beds than we had available. One model, just as an example, which was released in early April, known as the CHIME model, developed by Penn Health, said that by June 1st, there would be as many as 1,500 patients with COVID-19 in their hospital system, and that's LGH. And that was a similar model that was being predicted in all the hospital systems in our area. That same model predicted that there would be nearly 600 patients in the ICU on May 31st. Now, let's look at what the results were, and thankfully, neither of those dire predictions proved to be anywhere near correct. And that's, I don't mean to criticize our health systems. It just demonstrates that, the actual, what we've experienced compared to the data that was being presented months ago. And so, in fact, that model that I just mentioned that predicted nearly 600 patients in the ICU on May 31st, on May 31st in that healthcare system, we had 14. So 14 compared to nearly 600. So I just don't understand why just yesterday the governor took another unilateral action to, again, limit restaurant capacity and events, forcing restaurants to only operate for dine-in service at 25% of their allowable capacity. That's cutting in half what they had been allowed, according to him, before. And this is an order that is just going to continue to put these small businesses into further financial difficulty, and some of them just simply won't come back. I do understand that we're seeing some case spikes in Allegheny County, around Pittsburgh, and in Philadelphia as well, but we're not seeing that in York County. We're not seeing it in Lancaster County. In fact, York has been in green for over a month now. Restaurants have been open. Lancaster went a little later than that, but we have not seen a significant increase in cases, nor have we seen, in fact, we've seen a reduction in the number of people in hospitals. So, the action that was taken by the governor yesterday just simply is not based on the data. It's not based on what's happening on the ground. And it's really, really frustrating. In addition, I think the governor, in a time like this, when he's using unprecedented emergency powers, ought to be working collaboratively with our county commissioners, with legislators, and we just haven't seen that occurring in this case. So I'm very concerned about the additional restrictions that were just placed and the economic impact that's going to have. But that's just one matter. There's so much to discuss. So let's go to your questions again. If you have a question or comment, you can press *3 on your telephone right now. You'll be connected with a member of my staff who will take your question. So the first question, let's go to Kirk Baker. Are you there? Kirk,
Maybe it's me, Kurt Bleacher.
Oh, I'm sorry about that. My screen says Baker,
No.
So apologize for that, but go ahead. It is you.
No, we were having problems with background noise or something. Anyway, my question was, we're Christians. We've opened our church 3 weeks ago. We make everyone enter the church in one area. They must wash their hands, and if they don't have a mask, they get a mask. Now we have our ushers usher them in, and you must have a reservation for church. We only allow so many. We know what the seating is. It's a large church.
Yeah. Mm-hmm.
Yeah. So we usher them in, and we sit them at
individuals.
the end of the pews.
You have individuals. I'm sorry. Go ahead.
Yep.
Go ahead.
Individual pews with a space in between the pews. One pew is closed, one's open. Now we alternate those people in the next pews by either couples or families, and so on. We have had no problem in 3 weeks with anyone with COVID, with granting COVID. Now, the governor has even said he doesn't kind of like group gatherings inside of a building.
Mm-hmm.
This is our God. This is our God. This is our Lord. He'll take care of us no matter what happens. So, what's your feeling on the church gatherings, especially if we're taking, you come in this door, we take care of you, make sure everything's covered, spread.
Yeah. So listen.
And go out another door, and everything's wiped down all the time. We have one service. We used to have 3.
Yeah.
We now have 1, and it's working fine.
Thank you
and
for that question.
Smucker,
Yes.
Congressman
Go ahead.
Smucker, I love what you do, and you're incredible. I follow you. I'm on your emails. Keep doing what you're doing. You're my man. So keep doing what you're doing.
Thank you. I appreciate that. I'm gonna Kirk, as much as I love hearing what you're saying, I'm gonna cut you off because we do have a lot of people in the queue here. I'm gonna address what you said though, but thank you so much for calling in. I very much appreciate it. I completely agree with you that churches who are operating safely should be allowed to operate. I've been pushing for weeks now, months, for a reopening of the economy because I know that businesses care about their employees, they care about the customers, they are willing to follow the guidelines, they're willing to wear masks and encourage mask wearing, which I think we should do. But we can safely go about our business, and in particular, we can safely go to church. You're doing all the right things there. That's the first I heard, sort of taking reservations, but that helps you to ensure that you're limiting the number of people in the building at any one time. So it's extremely frustrating to me, and I know our state legislature has been doing all it can to help to try to sort of pull back and rein in the governor's use of the emergency declaration to really establish extraordinary powers for himself. But what's really frustrating is to me is he hasn't been very transparent. He hasn't been following the data, and he isn't collaborating with local officials. He isn't collaborating with the legislature at a time when he is using extraordinary powers that impact the lives of every single resident of Pennsylvania. There ought to at least be an attempt to build consensus and to work with the legislature that have a voice, a constitutional voice in this as well. So it's been very, very frustrating to me. I'm frustrated with what happened yesterday. I take this virus seriously. I think we all should and all do. I think we're going to need to continue to socially distance. I think we need to continue to wear masks to protect ourselves and to protect others who are most vulnerable. But we know now much more about this virus than we did in the beginning of March. We know who it targets. We know that close to 70% of the deaths in Pennsylvania have occurred in long-term care facilities and nursing homes. And we know how to protect those individuals. And at the same time, we fully understand, everyone on this call understands the impact for people who have lost their jobs, people who are at risk of losing businesses that they have built up over a lifetime. And we can manage reopening while continuing to protect individuals who are most vulnerable. At the same time, and I'll just go into this and then we'll get to the next question, but I think this is worth mentioning, there are some very promising developments on the therapeutic side. That would be treatments for the virus. We receive regular updates from experts, and very, very good news happening on that front. That is lowering the death rate from people who are most vulnerable. And we are, well, I call it Operation Warp Speed, but the amount of time leading up to a virus that will most likely now be available by the end of the year is like astounding. We have never, normally it takes 4 years. We're going to do it in 4 months or so. And that's really due to the strong commitment from the president, the administration, to take all efforts in the government and ensure we attack this in the best way we possibly can. So there's really good news on that front as well. But yeah, it's really, really frustrating how long the economy's been closed down in Pennsylvania, and that we're sort of going back on that. But I really appreciate the question, and thank you so much for the kind words as well. Let's go to Paula. Are you there? Paula, are you
yes,
with us?
yes, I am.
How are you?
I'm okay. How are you?
Doing? I'm doing well.
Okay.
Thank you. Thanks for joining us. What's on your mind?
What's on my mind is health insurance. My husband and I have been in a situation many years ago where we had health insurance, through a major provider, but our daughter had to be in the ICU for a number of months, and that 20% that was our responsibility. It was over $1 million bill, so it was over $200,000. So we've experienced firsthand what can happen when there is, a major hospitalization, and what that can do to you financially. So we're both self-employed, and we've been using healthcare.gov to the marketplace to purchase our insurance. And as we see that being kind of dismantled, but not yet replaced by the president, it's been kind of just falling apart. The cheapest insurance we could find on the marketplace is $2,200 a month, and that's with a $16,000 out-of-pocket deductible for the family.
Yeah,
it doesn't seem to be reasonable. We're also in the entertainment business, so we're furloughed. We can't work.
So were you able to access the PPP?
We were able to access PPP for the first 3 months, so that just ran out. And there's also
we are doing, and I want to get to your health care, but this is a good time to mention something else.
He works on commission.
Oh, okay. So I want to get back to your health care, but it's a good time to mention something that I want all the callers to hear. I am looking for your input on another aid bill for COVID. It's now clear that there will be another aid bill. I can't tell you exactly what's going to be in that, but I expect that we're going to pass that within the next 3 weeks. That's being worked through and negotiated now. In the entertainment business, it will. I don't know exactly what business you're in, but there are some businesses, including many in venues, in entertainment, restaurants, tourism, all of which are important in our area, that just simply won't come back in any way close to what you were doing pre-COVID for quite some time. I just met recently with an owner of a motor coach business, for instance. They're not projecting they're going to be back to anything close to capacity until probably 2020, at the end of 2021. And so, it's particularly difficult. And I think I kind of look at some of this federal aid as something similar to maybe eminent domain, where when government takes something from individuals, there should be reimbursement for that. And really, when decisions were made to close down the economy, it's really a taking of the opportunity for benefiting from participating in the economy, providing a service or a product or whatever it may be. And so I think this isn't only about trying to save the economy and ensure it comes back, but it's about in some ways reimbursing people who just simply, through no fault of their own, were unable to operate because of government decision. And so, I think in this next bill, we should, really try to focus on, I think PPP worked for many companies. And I've been talking to companies the last few weeks as I've been getting out throughout the district. It was amazing how quickly it was set up by Treasury, SBA. It was the one time since I've been in Congress where we, on a bipartisan basis, acted so quickly. And there were problems with it, but I think it worked. It just does not target enough the differing impacts on different companies. And so I think, like, for instance, restaurant, entertainment, venues, all those, there should probably be some additional help, and I'm hoping that's included in this. In terms of healthcare, I've heard so many stories like that. and I know the individual marketplace, which I believe is what you've described that you're on. Those rates have climbed dramatically over the last few years, and just simply, they work if you're one of those who is subsidized, but if you're at an income level where you're not subsidized, they're just unaffordable. They're just not workable. And I've heard a lot of
we actually did last year we did without it because we actually had put aside $1,600 a month to purchase health care insurance. That was our budget. We thought that was reasonable, and there was nothing on the marketplace that you could buy. So what happened is that York County, for example, is pretty much run by WellSpan, and WellSpan pulled out of the marketplace. So I think we should continue to build a competitive marketplace, and you can use the framework of that individual marketplace and make it more competitive by allowing more options, more flexibility, allow insurance companies to design plans that consumers want, and more choice. I was a business owner for years. You are as well. I think more. I think competition, free market principles work to build a better product and at a more affordable price. And there's no reason why that can't work in healthcare. We've over a long period of time been moving away from that. But what the administration is trying to do is create more of a marketplace that will drive prices down. And I think ultimately that's the way to go. There are others, obviously, who are pushing a single-payer healthcare system, which I think would continue to drive costs up. I just don't think that will work. I think you need the innovation that comes with a free market. I'm a co-sponsor of a bill that provides a number of different provisions that will, I think, drive down the costs through free market ideas. It also includes high-risk pools. There are a number of things that we could do to really improve the market and drive down costs. And so that's the direction I think we need to go. I think this idea of Medicare for all. I'm really happy to hear you say that. I hope that's the direction we can go in, because it has to be a bipartisan issue. It doesn't seem to have changed any between one president or the other. The availability of the plans is so limited, and we are not subsidized. And because we went through that so many years ago with having to sell our house because of the healthcare costs, we've been really scared to be without it. And someone who gets COVID who ends up on a ventilator, that no one's really talking about it, but that is a tremendous amount of money, tremendous. And if you're not insured, it could absolutely do you in.
I hear you. Sorry you had to go through that, and I can tell you it's a top issue that we need to continue to work on. But I appreciate it. We have lots of other calls, so I'm gonna keep moving. Thank you. Good talking with you, Paula. Yep, you bet. Let's go to Paul. Are you there? Paul, I think it's Paul Tittle. Are you there? Paul, one more time. Are you there? All right, let's go to the next caller. Jordan Jacobs, are you there?
Hello?
Jordan, are you there? Hi, how are you?
Hey, Jordan King, not Jacobs.
I was beginning to think no one was hearing me. Go ahead.
I'm here for you. So my question, hold on, I'm taking the trash out right quick. Give me a quick second here.
Yeah, sure. Are you from Spring Grove, I see?
Yeah, Spring Grove, yep.
I was just at, this is not a commercial, but I was just at Computer Brothers Cheese today, and boy, they make some good cheese.
Yeah, I think they're like an internationally renowned cheese company or something like that. Yeah, they're pretty good up there.
It was really great, but yes, I was just in Spring Grove, but go ahead.
Yeah, so my question, I like what you were saying earlier about, thinking about having another 8 package. And that's been on my mind a lot, just seeing this pandemic go on. A lot of working families have been left behind and are really struggling. And especially considering, Lancaster City is such a diverse city with, lots of immigrants and lots of different communities there that are thriving. And some of those communities were left out of the first aid package and were completely decimated in Lancaster and in York. So I'm wondering, what your thought is about having another.
Which communities are you talking about?
If I'm not mistaken, I believe like a lot of the undocumented communities or people that do have legal types of residencies, they were excluded from the first aid package.
Yeah.
So not only are they don't have a job, but now they have no ways of sustaining themselves, and then just working people in general that have become unemployed, and now that $600 a week isn't coming anymore, and that's adds another layer of fear onto things and panic and how am I going to provide for my family? So I'm just wondering what your thoughts are on that, going forward, and how you can help some of our desperate communities here in PA 11.
Yeah, absolutely. So as I mentioned, I think there will be another stimulus package. I think the stimulus package really was successful in helping people who had lost their jobs. And even other than that, it helped people to keep their jobs through the PPP. And as I mentioned earlier, could it have been improved? Sure. But so I think we will probably build on what was provided before. There may be additional aid dollars going, direct payments going out to certain populations. Be some income level. Again, last time it started topping out at $75,000 annually, or $150,000 per family. That might be a little lower this time. Really trying to target the people who need it most. PPP, as I said, helped a lot of people keep their jobs. It reimbursed companies to keep their employees on. There may be some extension there. I think we did it about right in terms of the timing. We really wanted to ensure that the dollars were driven out effectively and as efficiently as possible, and then sit back and be sure that we fully understand where the greatest needs are. And so I think we're looking at all of that, and I think there will be additional aid for people who have not been able to work and who are not able to go back to their jobs. But the aid is only for citizens. Someone who's undocumented is not eligible for the aid, and I do not expect that they would be going forward either. But other than that, I think just about everyone that has lost their job or whose job is at risk will probably already receive some benefit and will continue to do so for another extended period of time. So thank you. Let's go to Janelle. Are you there, from York?
Yes, I'm here.
Hi, how are you?
Okay, how are you?
I'm doing fine.
Good. My question had to do with extending the CARES Act, which you did touch on a little bit. And the Republicans are making a statement that they feel like people are staying home from work or not going back to work or seeking work because they make more with the extra $600. However, in my case, I worked for York County Children and Youth, and as you know, the Human Service Center there is closed, so we're furloughed. I can't go back to work even if I wanted to. So this is going to put my family in a situation where without that extra $600, we are going to be in a huge struggle, because now my husband's employer, he was working his regular 40 hours, but now they're sporadic. Some days he only works one day. Some days it's 2 days.
Yeah.
And
Can I
just
ask you a question?
Sure.
Yeah. Let me ask you a question, and then I'll give you my thoughts on this. And I share the concern that you had mentioned. But like if you received unemployment, I get it. You can't go back to work, and we want to ensure that you're able to get through this, and that's the purpose of the aid. If you received, and state unemployment in and of itself never covers what you would have earned when you're on the job.
Correct.
I'm okay with, and I'm wondering your reaction to this. For a short period of time, I would have rather seen, rather than just paying a flat $600, we just make sure people are made whole so that you're earning, or through the state unemployment and the plus up from the federal, you go up to the total amount that you would have earned otherwise, but not over.
Right.
And I think that would eliminate what really is happening. I've heard it from a lot of employers where, if you do the numbers, it makes sense. People are earning more. Some people, depending on what you were earning before and depending on state employment, people are earning more, and so are reluctant to go back to work. And I get that, but it's really incentivizing sort of the wrong thing, if you will. And I think people need to look long term and realize, well, if they're making the decision not to go back to work, this extra $600 runs out on July 31st. So you ought to be thinking about beyond that. So I think most people are still going back to work, but yet I've heard from employers who were upset that, when they call an employee back, they say, well, why are you calling me back? Because I'm doing better at home. And I don't think that's right. So I'd be okay with, So tell me if what you're asking for would be to at least get close or be equal to what you were earning before, but not more. Am I understanding that correctly?
Right. I mean, having, for just me in the household, getting the extra $600, yes, I did get more than what I would have at work. I would rather be. I love my job, but now my husband is losing hours and is not getting unemployment. There's a whole big mess with his unemployment application, and it just happens to be at the end of the $600 extra is going to end. We are going to struggle very, very much. And also
in your situation, I have no problem. Like I say, I have no problem. Like, this is designed to help a family like yours through this, and layering on top that your husband is earning less but not able to get unemployment. It makes sense for you. But if your husband were on unemployment, you both lost your job. I would have been perfectly. I think it would have been fair initially to say that gets capped at your total wages before you were laid off. I think that would have been much better. We're talking now even about potential, an incentive to go back to work, and it's recognizing that. I know this isn't applying to you, but but no, I appreciate you calling. I do believe, just for what it's worth, I would have trouble supporting a bill that continues to just plus up flat basis $600 where people are earning more than they would have otherwise. It's incentivizing the wrong thing. But I do believe that the president and the administration are open to the idea of extending that at some lower amount. And I wish it would be tied more to the wages of the individual who lost the job, but I guess that would just be hard to do, This was done so quickly that, again, there are issues, but that's one of the things that's one of the areas of the bill that I think has caused the most sort of consternation and problems, in terms of what it's incentivizing. And so I'm hoping it's changed, but I completely understand your situation. I'm hoping you can get back to work soon. Really appreciate the work you do at Children and Youth, by the way.
Thank you. Like I said, I love my job. I just wish we could get back, in there, but
hopefully sometime soon. Really great talking with you. Good talking with you. I'm sorry, I'm gonna keep moving to the next caller, but thanks, Janelle. I really appreciate it.
Thank you. Bye-bye.
Let's go to, let's see, we got James from Red Lion. Are you there? James, are you there?
Yes, I am. How are you?
Hi, good. How are you doing?
Outstanding, sir. I
Good.
want to first say that I truly appreciate this forum that you have been doing. I got a call and I didn't even realize that this was happening. So I honestly, I want to say that this should be more normal. Let's just say the new normal, that we do this more often. Okay?
Yep. Well,
And
I'm glad to have the opportunity to talk with you. I really enjoy doing them and get a lot of good feedback on them. It's a way that you can write it from your home, hear a little bit of an update. It's a way for me to hear directly from you. So, and then particularly through COVID, we've been able to continue this, which was really great to be able to do that. So thank you. So what's your question tonight?
So I'm a 9-year veteran, okay, and I've been working for Army MedCom for 11 years beyond that, okay, and I have a concern about the vaccine, okay, and I don't know what your concern is with the vaccine, but as a federal employee, I have a concern about this vaccine. I have a medical background. This vaccine is designed to basically manipulate our RNA, okay, and as far as I'm aware, this is a first with a vaccine that actually messes with our genome. And I do have a problem with this. I know it's being rushed, okay, under this guise of this, but, it's something where, are you supportive of everyone being forced to take this vaccine?
No.
Or is it going to be a choice?
It's going to be a choice.
Okay.
And I'm happy to address that. And I do not have a medical background, so you probably have more expertise. I'm sure you have more expertise in this than I do. What I can tell you though is what the experts have been telling us. We've been getting regular briefings on this for quite a long period of time, since February. And just recently was on, just yesterday, matter of fact, was on a conference call with the vice president, who is head of the coronavirus task force, and with the head of FDA, who is responsible to approve drugs and vaccines and so on.
No, and you know what? I totally respect that, but I also know the FDA also shovels people in and out from pharmaceutical companies to come in and head into it. So, to me, I fall on to the side of a little bit of caution. Okay.
Yeah.
With that,
of course.
And and especially since Dr. Fauci just recently, if I'm not mistaken, I could be wrong, he denied the ability to have a study done for the validity of even wearing masks. Why would he do that?
Well, I don't, honestly, and I'm going to move on here, so I'm going to go on to the next caller after I question you. So I appreciate the call. So just a couple things on FDA and on Fauci. I think Dr. Fauci is great. I think he has been one of the individuals who I have really relied on to provide advice throughout this. I can tell you that the best and the brightest of the people who have made this their life's work to be able to be prepared for a pandemic like this are engaged in combating this. Fauci is one of those who I respect his opinion. But what I can tell you this in terms of your concerns: a vaccine will not be required. We think people will want to. Most people will want. If some people don't want, that's fine, as long as there's not too many. But most people will be glad to have a vaccine that is safe. And the head of the FDA just yesterday said the overriding number one issue is to ensure that the vaccine is safe for the American people to use. The last thing they want to do is rush a vaccine to market that hasn't been completely vetted. But I'll say this, and I don't know about your RNA. I think you said RNA. I don't know about that. I don't know if one of the vaccines that's being developed is handling things differently than past. I don't know enough about vaccines to be able to answer that, so I won't even try. But what I can tell you is that there are dozens of vaccines under development. They also, all vaccines, including the ones under development now, go through 3 different phases of clinical trials. The first, I think, is in animals, and then in a very small group, and then in a much larger group with thousands of people. And there are several of the vaccines that are in that phase 3 clinical trials with thousands of people. And until we're through all of that, we won't know whether the vaccine is safe and will work. What we can say is that the first 2 phases have been very, very successful. And we believe that one of these vaccines is going to be available for use by the end of the year, which would be record time for developing a vaccine. Normally something like this might take 4 years. And it's going to be done in months rather than years. The other thing that's happening because of the federal aid dollars, these companies are already manufacturing vaccines in the hope, so they built factories, they're manufacturing the vaccines in the hope that they will be successful. That way, once one of these clinical trials is successful, we know the vaccine is ready. We'll be ready to go in an instant. So there's a potential that millions of vaccines will be ready by the end of the year. It's very, very good news. And I will have complete confidence for myself. I certainly will be vaccinated, but I know some individuals may be concerned, and that's going to be everyone's choice what they want to do. But we are making record progress in both therapeutic treatments and a vaccine, and I'm very, very encouraged by what not only what the progress we're making there, but knowing more about the disease and how to treat it is reducing the fatality rate as well. So there's a lot of good news happening on that front. But thank you for the question. Let's go to Marlene from Seven Valleys. Are you there?
Hello. Yes, I am.
Hi. How are you?
Just fine, thank you. I want to know.
What's on your mind?
My question is, I want to know how can Governor Wolf close a cabinet factory outside of Mount Union in a rural, low-income area and take their business and give it to his brother's cabinet factory, which he kept open. And yet, during this corona, and theirs isn't, they closed theirs up there. They put in 2 waivers for it, and, they weren't allowed to have it open. How can he do that?
Yeah, so
and it was on the news in Harrisburg, they said, but not here in York area. I haven't seen it, but our granddaughter worked there.
Oh, at the cabinet company that was closed?
Yes.
Okay.
Right outside of Mount, but I can't think of the name of it, but they said it was on the news around Harrisburg. I don't know if you saw it or not.
People complain of that.
Yeah.
But how can he close that and keep his brother's factory open? And they said during this virus, and the business that they were doing up there is being taken away and given to his brother's factory.
Thanks, Marlene. I appreciate that question. I don't. That's the first I heard that. What I did understand initially was that the cabinet factory that the governor's family owned at one point, or I'm not sure if they still own it, but had received a waiver or at least was allowed to continue to operate while other similar businesses were not allowed to operate. And I do know that there was some news in regards to that. That might be what you're referring to in Harrisburg area, upon which the governor reversed the decision to allow that cabinet company to operate, and it was closed like other cabinet companies. And so it just I don't know the details on that, and I appreciate the question. I don't specifically know the details on that. What I can tell you though is, in a time like this, you want a leader who's not only making the right decisions based on the data, but you want transparency. You want a lot of good communication. And I think this administration, the Wolf administration, has just fallen short on that. I don't know how else to call it. The waiver process that initially allowed some businesses to operate and others not, picked winners and losers. There were home builders, for instance, in our district, a bunch of different businesses that had competitors allowed to operate and they weren't allowed to. It was a very, very poorly rolled out, very poor decision making in that. It was really, really disappointing to see. And I think, as I said, unprecedented powers. You need that transparency. You need that willingness to talk to the media, take questions, and we just haven't seen that in all of this. And it's sad to see. We deserve better than that, I think. But thanks for that question. Let's go to Susan from Shrewsbury. Are you there?
Yes, I am.
Hi, how are you?
Okay, how are you?
I'm doing well, thank you.
My question is, I would like to say that I do vote for you, of course, and that I think that most people, just have to listen to the news, and hopefully, they vote more people in that are going to make the right decisions. That's all I have to say about that.
Elections matter.
Right.
Elections have consequences. So,
right.
I agree. And, maybe people don't always agree with me, but it's important that, no matter what you believe, if you really want to make a difference, you got to get out there and pick who you think is the right leader. So I appreciate that, and I appreciate your comment as well. So thank you.
I have a question about, I know that the school thing is like a total disaster too right now, and I know that, I don't agree with a lot of the decisions that were made with things either. I think that when it started, that everybody just panicked and was flying by the seat of their pants, making decisions and not taking the time to put some common sense and thought into things. But as far as the schools opening, are they? I know they've probably been talking about it for months also, since the kids had to be taken out to begin with. But to me, wouldn't the best thing to do would be to open the schools, give the parents the option, and there should have been a thing put out where parents made the decision so they knew how many kids parents would allow their kids to come to school. And I realize, because I know of children that have underlying issues, they cannot take that chance of sending them back to school, and that's understandable. But I think going all to on the computer for these younger kids is not an answer. We have enough problem with the education system and children not, graduating from school literally and not being able to add, subtract, multiply, and divide, and, do basic English and things. And I think that they need to think about, like, the younger kids, they should have, I think definitely the kindergarten kids. But again, there's going to be children that can't go. And I think they should have it every day if the classrooms can be small enough, if there's enough kids that, or their parents would rather they do it at home, or they need to. And then actually do the classroom, actually do the video from the classroom during the day, the whole day, while the teacher's in the classroom. Instead of, if the teacher can do it from home, they can do it from the classroom.
It's a good idea, and I'm sorry. I want to answer that question, and I don't mean to cut you off, but I want to try to get to a couple other questions before I chat. So I really appreciate it, and you know what? I don't think there's anything that you said that I disagree with. I think we can open the schools. We need to open the schools, in my mind, and we need to open the child care centers. You have too much impact on affecting people's ability to get back to work without. And there is a huge impact on students who are missing, months of learning. And yes, schools have, I think, done a great job of responding, but kids need to be in the classroom to really learn in the way they should. They need to be interacting with other students. And, you all know, everybody knows, school learning builds year after year. We're that much further behind with students that are now going into a different grade. And I think, if we couldn't do it safely, yes, absolutely. But we can do it safely. And there's going to be requirements. Students will probably have to wear masks. They're going to have to do social distancing and so on. But I think it's absolutely critical we open the schools. I think we're going that direction in Pennsylvania. I just hope we stay the course. I can tell you just two other quick things. This is just anecdotal. The school district, my son will be a senior next year. They have had a lot of input from parents. They've asked for input on, how surveys and things of that sort, asking for any ideas. They're spending a lot of time trying to figure out how to do this safely. And I think they're going to be successful at it. But then I was just meeting with parents today who just said, you know what, their kids are older, said we think rather than go through that, we're just going to have our two sons learn at home. We think they're going to be fine that way, and we just feel more comfortable with it. And that should be their choice. And your idea of broadcasting the classroom is a really good one. That would allow that choice, which I think parents should be able to have a choice in this. But that would allow for that to occur. But I want to reiterate again, I think it is really important that schools and child care centers open, and I know that a lot of people working hard to ensure that we can do that. We can do that safely. So thanks. A lot of great ideas there. Let's see. Let's go to Joyce from York. Are you there?
Yes.
Hi, Joyce.
How are you?
Okay. How are you?
Fine. I'd just like to comment about York and Lancaster having a sort of low flu epidemic. It's because we've listened and we wear a mask.
Yeah.
And we've done most of what they've told us to do.
Yeah.
I think that's basically what we've done.
Go ahead.
Huh?
Go ahead.
We've listened to them, and we've done it. We haven't protested without the mask, even.
Yeah.
From what I've seen, I've been to the doctors, and everybody's worn mask.
Yeah. I agree, Joyce, and I appreciate you bringing that up. I think most people really care not only about themselves but about their neighbors, and they want to ensure that we're doing everything we can to stop the spread. I think schools are going to be willing to operate by the guidelines. I know businesses are willing to operate by the guidelines. We know that we're going to be living with this virus. Even if we're successful with the vaccine, as I said, we still have another probably 6 months or so that we're going to be living with us, and we just simply cannot keep everything shut down. It will be dependent on how willing we are to abide by some of the guidelines, which really do work in mitigating the spread. But I tell you what, I agree with you. I think throughout our community, we've been successful at doing that. And I'm proud of what everyone in our community has done to ensure that we're doing everything we can to stop the spread and to fight this thing. So I think you're exactly right. Let's go to Boris. Are you there?
Yes, sir. I sure am. I'm thankful to be on the call. I've just got a couple of comments and stuff. I guess not so many questions and stuff. I work in health.
Make it pretty quick.
Okay, I work.
Yeah,
Okay, I work healthcare. I don't see
Yeah.
the numbers that Governor Wolf's saying. I don't think, also, as far as extending for everybody, I disagree with that because there's no free lunch. I think give it to the ones that really need it. I've got family that are abusing it. Because of Governor Wolf, I bought a car outside of the state because I couldn't get one in this state. And I think we're all big boys and girls. I think we've got common sense as far as social distancing. I think, like you're saying, open it up, let people, do, because we know what we need to do. And as far as, because it's been, I agree with everything that you and the president are doing and stuff. And I just think that, just keeping it shut is a mistake.
Yeah. Well, thanks, Boris. Boris, I appreciate that. I agree with you, by the way. We have to be concerned about the debt. And, I've been worried about an annual debt or deficit of $1 trillion. But now we've added a couple $1 trillion of additional debt. I think we had to do that. And I think we have to come back around and address the debt problem. But you're right. There's somebody's going to be paying for this down the road. And so we ought to be ensuring that anything else we do is targeted to people who need it. And so that can be businesses who need it, people who are unemployed who need it. I completely agree with you. It's a great thought, and thank you for your comments. We're at the end of our hour already. I apologize that I didn't get to more questions. Maybe it was a little long-winded, and I don't know. But I know we have a number of people in the queue. Before you hang up, though, let me say this. If you have a question, if you need assistance of any kind, and you're on the line, you can stay on, and you'll have a chance to leave a voicemail at the end of this call. So just stay on the line, leave a voicemail if you want to do so, and then we'll get back with you. Either myself or a member of my staff will give you a call. I also want to say that we are here to help you in any way we can. So if you have any issue, in terms of dealing with the federal bureaucracy, like, for instance, we help a lot with Social Security issues, IRS issues, Veterans Administration issues, and so on. That's what we're here for. So it's one of the reasons we're here. So if you need any assistance, don't ever hesitate to reach out. I'm interested in your opinions. If you hear of something that's going on in the news, have opinions on legislation, please let me know. You can go to my website, smucker.house.gov, for additional information. Again, that's smucker.house.gov. You can give us a call. You can email us. You can sign up for our newsletter on that website, and follow us on social media as well. So thank you for joining me tonight. I really appreciate your time and your willingness to discuss some of these important issues that are affecting our community and our nation. Again, sorry we didn't get to all the questions, but stay on the line. Thank you so much for participating. You have a great night.